Thursdays. My name is Jackie Knight, and I'm a program manager in professional and continuing education here at MassArt. I'm just going to do some introductions to our panel and moderator, and then I'll turn it over to Judith. So, what is Think Thursdays? Think Thursdays is a series of conversations about current and future practice in disciplines of art and design with CE faculty, alumni, and friends. This evening's discussion concerns the practice of industrial design. With us are our moderator, Judith Anderson, and our panelists, Raschelle, Barkume, Nazareth, Ekmekjian, Alexis Hope, and Roman Lomeli. I'll give a little background on each person and then turn things over to Judith, as I said. Raschelle Barkume is an accomplished human factors engineer at Johnson & Johnson, who routinely works with designers and engineers to develop cutting-edge, user-centered medical devices used in orthopedic surgery. Raschelle applies her knowledge and understanding of human capabilities and limitations doing usability evaluation activities designed to gather user insights and translates the results into medical device designs that transform and improve individuals' lives. Before Johnson & Johnson, Raschelle was a senior human factors specialist at Emergo UL, where she led complex, high-fidelity usability tests of devices used in the operating room, including a surgical robot and cardiovascular imaging system. Raschelle received her Bachelor of Science in Mechanical Engineering from Oregon State University and is completing her Master of Science in Industrial Engineering, Human Factors / User Interface Design, also from Oregon State University. During graduate school, Raschelle worked in collaboration with the U.S. Army to create the first set of user interface design specifications for next-generation laser target locator modules, and earned national recognition for the design of a workstation for people with disabilities. Welcome, Raschelle.
Hello, everybody. Hi.
Nazareth Ekmekjian is lead of design at Piaggio Fast Forward, where he oversees the design and development of Gita, Piaggio's first product. Nazareth has had a key role in the evolution of Gita from concept to product, including the series of prototypes currently being developed. In addition, he's responsible for establishing and managing Piaggio's design workshop, which includes a multi-axis KUKA robotic arm, 3D print lab, and other composite material applications. Prior to Piaggio Fast Forward, Nazareth was at Machinius, where he worked on design products that use novel means of robotic fabrication. Select clients at Machinius include Zaha Hadid Architects, Greg Lindform, and Loranta Lash. After Machinius, he managed the robots house at SciArc, where he supported design studies and seminars using the newly constructed multi-robot lab. Nazareth received his bachelor's in architecture from the Southern California Institute of Architecture and his Master of Science in Architecture Studies from MIT. Welcome, Nazareth.
Thanks.
Alexis Hope is a designer and researcher at the MIT Media Lab and Center for Civic Media. She serves as the creative director for 10 Forward TNFWD, a design studio focused on creating playful digital experiences. 10 Forward's flagship project is Fold, an open publishing platform originally developed at MIT to help journalists, educators, and organizations tell complex stories. Prior to joining MIT, Alexis led a project to develop a portable ultrasound machine for midwives in Kenya, Uganda, and Seattle. She was a National Science Foundation Graduate Research Fellow from 2012 to 2015, focusing on bringing human-centered and participatory research methods to technology design. As part of her commitment to participatory design, she helps organize unique hackathons and civic technology workshops around the world. She has a BS and MS in Human-Centered Design from University of Washington, is a PhD candidate at MIT's Media Lab, and is also pursuing a furniture design certificate at MassArt. Welcome, Alexis.
Thanks.
Lomeli is an accomplished industrial designer and the platform lead for Dupuy since Spine. So that's how I used to say that. He balances creativity with a consistent drive and focus on business goals. With a strong attitude for mechanics as well as visualizing and communicating complex concepts through sketch and design, he fills diverse roles at Dupuy. Human factors consultant working with patients, surgeons, nurses, technicians, and sales reps to understand the key needs of each, and designer collaborating with other ID groups to develop a cohesive visual language and look for Dupuy Saints spine products. Prior to Dupuy, Roman was industrial designer at Lennox Tools brand of Newell Rubbermaid, redesigned hand tools for professional tradesmen, and at ESG Engineering, he worked on automotive, interior, and consumer products. In addition to his design skills, he has a background in computer systems and he has served in the military. Roman graduated summa cum laude from Arizona State University with a BSID in industrial design. He also has a BA in sculpture with a minor in creative writing from Virginia Polytechnic Institute and State University. Roman holds 9 patents and has many applications in process.
Hello.
Welcome, Roman. Finally, everyone knows Judith. Judith Anderson is chair of industrial design at MassArt. She began her design career in the 80s at GE as a mechanical design engineer, followed by several years providing design consultancy services in London, UK. Her current focus is on curriculum development and creating collaborative and cross-discipline opportunities for students. Judith is building innovative relationships through the art, business, medical, and academic communities. Her professional work as founder of AA concepts range from sport, fitness gear, healthcare, lighting, home furnishings, and design for social justice. Judith has an MA in Industrial Design Engineering from the Royal College of Art. Welcome, Judith. And
hi.
Over to you.
Great. So I'm pretty excited to be surrounded by these individuals. Just to give you a little background about the connection and the chosen decision making of the panel. I'll start with Nazareth. Nazareth is a really good friend of a really good friend of mine that's actually based in, he's back in the Netherlands now, Sarkis, which I just spoke to today, and he said hello. And it was a really great connection. I met Sarkis at the RCA, so when he found out that he knew someone in Boston, he quickly called me and said, hey, you need to meet this guy, he's awesome, which I did, and he is. So I'm really excited that he could come and join us. Alexis is, as you guys know, just phenomenal in terms of like being a great advocate for MassArt at MIT and being here playing with us, thinking and creating. So it's great to see her here, and I'm glad she could participate. And then Raschelle and Roman, I've just met. And mainly because the initial person on the panel was Vanessa, a really good friend of mine, and their colleague. And she could not make it tonight, but these two are very kind and quick thinking to come and support us for this talk. And still being at Johnson & Johnson and giving us the medical field kind of perspective, I'm super, super pumped by that. So that's my connection with them, and I'm really super happy that they're here. So we're gonna just have a conversation, just keeping this really kind of loose. And I got 3 prompts to kind of talk about. And my first one is, I need my glasses, sorry. I should have printed it out larger, but I didn't, because I'm, vain. So, what are the key technologies you are leveraging in your design work, and how are they affecting the human experience? And so when I'm talking about like key technologies, we've got AI, we've got AR, VR, robotics, the IoT, like all of those things that we're just throwing out those acronyms and talking about. where are you guys in terms of leveraging these? And then how does it actually affect and how are you worried about the effect to the human experience? So we can go, down the road.
All right, so this is a multifaceted question, and there's a lot going on. So I'm in the medical device space right now and dealing primarily with spine surgery. And we are actively working on robotics, artificial intelligence. We're using virtual reality, eye tracking. Almost every major new technology is in scope. The promise of robotics right now, Johnson & Johnson doesn't have a surgical robot on the market yet, other than one we just acquired.
That's right.
So, but we've been in develop for them for a number of years, and they're coming. The promise of robotics in spine surgery is very broad. Everything you do with the spine is dangerous. You can hurt people in a number of ways. So with robotics, you can get much more accurate. You can get much less trauma to the patient. The individual can get out of the door quicker, back to their life. So that's where we're trying to go. And then with artificial intelligence, the more information you have, the better decisions that you can make. In a lot of surgeries, you can get very good outcomes. If you get a knee replacement, you're 95% going to have a better quality of life after. With a number of spine procedures, that could be as low as 50%. People have a good outcome. And a lot of that is due to variability in the surgery and other factors. With artificial intelligence, we can get better about deciding what kind of patient should get what type of surgery. There's a lot of challenges with that as far as patient data and dealing with some very sensitive issues there. But all of that type of work is in process, and I would expect to see the effects of that within the next 5 to 10 years in a average person's life.
Okay.
Yeah, thanks. So I can chime in from the medical device perspective as well. I've been at Johnson & Johnson for about 6 months now. And before that, I spent about 4 years consulting in human factors for medical devices specifically. And so I had the opportunity to see not only products used in the surgical suite, but also products used at home by people with diabetes, by people with MS, multiple sclerosis. I had the opportunity to see a number of different devices used in kind of the outpatient area, and so kind of a range of complexity of devices. And there were some trends that I was seeing in my consulting days, one of them being the use of smart devices. And that can really mean a number of things, but just enhancing people's ability to interact with the products and enhancing the product's ability to affect patients' lives and care teams, their abilities to treat their patients. And I think you should probably come back to me when it comes to the potential concerns and impacts on the human experience, because, I think technology is seen in a very positive light and for a lot of really good reasons. And I think the flip side of the coin about potential pitfalls when you rely too much on technology is important to consider, although it shouldn't prevent you from innovating. But yeah, maybe we can come back to me and we'll continue.
I work across lots of different mediums over at MIT, sometimes digital media, sometimes wearable electronics. My medium lately is breast pumps, which I'll tell you guys a little bit about probably at some point. But kind of one of the things that I'm concerned about is who's participating in inventing the future. So I think we have some real problems with people who are missing from conversations about what our future is going to be like. And so I kind of use the breast pump as it's an example of a technology that it hasn't been redesigned in decades until very recently. And it's there are many technologies and things that are overlooked and marginalized. And I think that's because up until kind of now, a lot of women are not participating in technology design. So trying to change who's at the table when we talk about the future is something I care a lot about. And we can get back to that in some of the concerns. I also spend a lot of time, my lab at the Media Lab is called Center for Civic Media, so we talk a lot about technology for social change, both the positives and negatives. And one thing we talk a lot about is kind of bias, issues of bias in artificial intelligence. So thinking about the fact that facial recognition performs poorly on like darker skin tones, for example. So if we have technologies like police surveillance cameras, that's a huge problem. So we think a lot about auditing and interrogating these technologies we have for instances of bias, and thinking about the fact that the benefits and harms of technologies are kind of unevenly distributed. So people who are kind of have more and are more privileged are more likely to be kind of beneficiaries of technologies, and those that have less are more likely to be harmed. So we think and talk a lot about that.
This is going to be very anticlimactic, but I can answer that question, I guess, in two parts. The first part, I think, for me, in a sort of like speaking on behalf of my personal background, coming out of architecture, the question of leveraging technology, immediately, I think about skill sets and toolkits and things that we have at our fingertips that have become so integral into, the way in which we produce that oftentimes we kind of just overlook it and just sort of rely on the fact that it's there and you need it to kind of do your work. Speaking on behalf of what I do currently, so the product that our company is currently bringing to market is it's a following robot that has the ability to recognize through sight by seeing through cameras its user and essentially, be their companion while being able to carry, 45 or so pounds of weight. And the first question that we get from, people who are seeing it for the first time is, well, how does it do that? What do I need to have on me? Is there AR involved? Is there, any of this? And the answer is no. It's very simple. It's really only using, 3 cameras and a depth sensor, and through a whole series of kind of algorithms that I wouldn't even have the ability to speak to you, honestly. We just try to kind of humanize it in the best way possible, and we just say, well, it senses and it sees, but there's really nothing beyond that to kind of take away from sort of like creepy factor of what's commonly associated with those types of products.
So as you guys explain how you're using technology, I want to also ask, is there a need for you to actually manipulate the technology as you're designing with it, or are you using experiences to then leverage what technology is doing and then having other people kind of like follow in that?
So we're manipulating a lot of the technologies.
Okay.
One thing that I didn't mention is 3D printing. So we're using 3D printing for a lot of things, and recently, or previously, you weren't able to get an implant in your body that was 3D printed up until about 5 years ago, and only more recently into the spine. And there's a lot of reasons for that, but having 3D printing allows you to do far more with customizing, creating structures that can do more in less space. And we're modifying the technologies, the surfaces to get better bone fusion, using materials that will bio-reabsorb into the body over time. So these things, didn't exist up until recently. J&J didn't create all these technologies, but we're certainly leveraging them and modifying them to do a number of things.
Any other? No? Sure. That's fine. So my next prompt is...
Sorry, actually, I did want to circle back to the
Okay.
concerns about
yes.
the human experience.
Right, okay.
Is that something you wanted to talk about as well? Okay, great.
That's good.
Sorry, I didn't want to jump in if you...
'Cause-
Okay,
yeah, okay.
great. Since it's a conversation.
Yes.
So in my role as a human factors engineer, I will be the first to admit I am not a designer. You do not want me designing your products. However, What I have to say is really valuable when it comes to designing products, because my role is helping put the designs that you all develop, that Roman develops, in the hands of the actual users. And it's my goal to elicit meaningful feedback from those users about the products we're developing, and then convey that in a really impactful and insightful way back to the development team so they can incorporate the user experience back into the design of the products. And so human factors is really the study of human capabilities and limitations, cognitive science, psychology, anthropometrics, which is measurements and things like that. But where it applies to design is that connection point to the user in the design process. And so some of the concerns about the human experience are, really, it comes down to really understanding your user. So when you are incorporating technology into a design, think about if your users are going to be of, for example, an elderly population, an aging population who is perhaps not as tech savvy as the younger population. For certain disease states, that would be more important. So people with diabetes can be older. They can have degenerative conditions, degraded eyesight, and neuropathy. So loss of sensation in their fingertips that comes along with advanced stages of the disease. And that really affects their ability to interact with the technologies that you put in front of them. And no matter how smart a device you make, if it's not intuitive for that person to use, it's not really going to be of any use to them. And the other concept we've talked about is robotics and automation to varying degrees. And that's always kind of a two-sided coin. Certainly, automating certain processes can alleviate some of the cognitive tasks that you're expecting your users to perform as they interact with your products. But on the other hand, you're introducing a new set of responsibilities. So not only should the user understand kind of overall what the process should be, regardless of whether there's a robot involved or not, but now they also need to be monitoring that robot to ensure they're able to detect when things are not going the way they should be going. And there's kind of an expectation that automation makes things easier. Well, in some ways that's true, but I think it's a little bit short-sighted to leave it there because there are often new challenges that are introduced and new cognitive tasks and things to keep track of.
Do you have a specific example of where it went wrong?
Oh gosh, that's a good question. I can draw on some experience doing some usability testing of a surgical robot that's in development. Basically, the intent is to augment the surgeon's skills. So the surgeon sits at a remote workstation, kind of in the corner of the operating room. The patient is on the table in the center of the operating room, surrounded by nurses and physician's assistants, anesthesiologists, is draped, and then has the robot kind of looming over them, for lack of a better term. And it's a minimally invasive approach, so several small incisions, and the robotic arms and the instruments kind of go in through the abdomen, which is inflated to allow for space for, kind of working in the abdomen space. And so there is kind of a new complication that's introduced. You have removed the surgeon from the surgical field. And even though you are trying to give him or her the tools to kind of make very minute movements very precisely and in a very controlled manner, and working in a very minimally invasive space to improve healing times and all these wonderful benefits, you've suddenly taken the surgeon out of their primary working environment. And so when something goes wrong, they now can't necessarily jump in themselves as they used to, and they have to rely on-screen indicators and alarms that they're hearing, along with all of the other sounds that are already happening in the OR and the rock music that they've turned up to 11 because they're really into it. And they have to trust their nursing staff. And so there's a lot of complicating factors that kind of, creep into a situation where you're thinking, well, it's obvious, this should be improving the experience.
Perfect. Okay. Alexis, you wanted. Okay. Okay, that's fair. So yes, we could always circle back to human experience anytime. All right. As you're creating new design experiences, products and/or services, how do you manage the ethical implications, or is this important? And some of the things that I'm thinking about is like privacy in the human connection, and data mining and collecting data, and the cultural nuances in terms of like how different cultures expect or accept technologies. So I'm going to start with Nazareth from the end, and we're going to come back this way.
Okay, so to answer that question, I'm going to have to speak on behalf of PFF for this go. We're at a really interesting time right now as we're kind of gearing up for our launch, and this question has come up in the past, and I think up until now it hasn't really been seriously addressed for us. But recently we've made the declaration that we are not going to be collecting any consumer's data. Even though this device has the ability to see, it's not storing anything, it's not recording anything, it's really only using what's in front of it to understand who it needs to follow, and that's it. So we're pretty open about that, and I think, at a time where you're seeing more and more products and services come out that rely on users' data, we want to be clear in stating that, this is really just about the simplest, like most human experience of walking, of just being a pedestrian again, and reconnecting with your environment. So to reinforce that, we just kind of have a pretty firm stance on the fact that we're just not collecting user data in that sense. And that's really, as far as we've come so far. It'll be interesting to see, where things go from here. So maybe I'll think about your question again.
The apps on our phone are not helping us now that we know that we're being recorded by, involuntarily, randomly.
Oh, sure.
Like things like that comes out in terms of the media. Then you start questioning everything around you. So it's tough to combat that. But yes, you have to be really strong in declaring that this is not what we're doing.
I think a lot about issues of equity and access as it relates to design. I'll tell the story of the breast pump example, so it makes a little bit more sense, and how I got into that, because I don't have kids, so it's totally a random thing. But anyway, so in 2014, a colleague of mine, she had just had her third baby in the second year of grad school, because she's amazing, and she was telling me about how she's like pumping milk on the bathroom floor of our building, and supposedly we're in this place where we're inventing the future, but it kind of quickly became clear from talking to her that there are some people's futures that were perhaps not as important as others, so this kind of use case of a nursing mother was just totally forgotten. And so we kind of decided that we were going to do something about it. We were going to design a better breast pump and a better experience. So we pulled together some people around the lab to kind of do this, and we had a little gathering, and then we wrote up something about it, put it online, and then said like, oh, if you have any ideas for improving the breast pump, send it our way. And we thought we might get like 12 emails or something. We got 1,200 emails from moms around the country who had like problems with this piece of technology, but who felt like they were like so amazed that somebody was actually wanting to take this design problem seriously. And so we had a hackathon around it, because we were like, all right, it's clear that like we don't have all the answers and there's a lot more insight out there. And so we kind of had a gathering, a hackathon. It's like 16 Hours to Glory, for those of you who know what that is. So it's like there's a design challenge, and it usually brings together kind of young tech dudes, but given this topic space, had a lot more women in the room, which was great. What ended up happening was a lot of ideas for like super smart pumps and all these really high-tech gadgets. And then after the event, kind of some new things started to come out onto the market, including like a $1,000 breast pump. And it was that moment we were like, wait a minute, this isn't the future we were hoping to invent. So this was kind of like an equity misstep on our part. So we went back to the drawing board, and we just had in 2018 our second Make the Breast Pump Not Suck hackathon. Suck in a different way. And this time we were really focused on equity and access. So we brought together like a very different community the second time to hack the breast pump. So not just kind of like, to be honest, like wealthier women who have probably paid leave, who can maybe pump in their office, but lots of other people who had different circumstances, who are maybe like trying to figure out how to feed their baby while they had like a job as a bartender or something like that. Much different circumstances. And so through that, we got many different types of ideas that were not $1,000 breast pumps. So just kind of to circle around to your answer, I think a lot about equity and access, and I think the one way that we're working to address it is to try and bring more and different kinds of people together to solve these problems.
Cool.
Back to medical devices. So when it comes to ethics and developing medical devices, there's a lot of conversation in the media recently about what medical device manufacturers' goals really are. Let's be frank, they're companies. Their job is to maximize their profits, and how do you reconcile that with, doing the right thing and developing products that are beneficial to your users? And so really the world that we live in as medical device manufacturers is one that's kind of ethics driven. So there's a regulatory imperative. The FDA has mandated that when we develop products, we are able to prove definitively that they are safe and effective to use when used by the intended users in the intended use environments for the intended uses. Very specific definition. But essentially what that does is it gives us the ability as designers and as human factors engineers to go back to project teams and say, hey, guess what? The user is really important, and we need to make sure that we're protecting them in any way and every way that we can. And oh, by the way, the FDA thinks this is really important, so you should too. Not that they don't already, but they're wonderful people, every one of them. So that gives us some leeway. So how do we do that? Well, we make sure that we're talking to the right people. So we do a lot of upfront work to make sure that we understand who our users are. And that's really important, is understanding, okay, it's not just, one subset, the wealthy moms maybe who have, paid time off. It's also, the working moms who have to juggle, maybe one or maybe 2 or 3 jobs and, have to worry about daycare and, the whole range of experiences. It's doing all the upfront work in the beginning to understand who you should be working with, and then using that to inform your design, and that really just carries through the entire process.
I love how you kept saying keep the user in the forefront, in the center. We talk about that a lot in our program here, so hopefully all the students that are here that recognize that it goes beyond just being a pedagogical experience. It's the real world, so thank you.
So I really enjoy working in medical devices because I feel like I'm doing things to help people. And working for J&J, they have a very strong credo that they've held to for a number of years. Even then, there are times that come up when you come across a concept for a system or a design that you can foresee potential challenges on ethics. So specifically, artificial intelligence, when you have enough information that you can inform surgeons what kind of potential outcome they're going to get from a certain patient with a certain type of procedure, you run the risk of surgeons turning away patients that really need help. And this happens already today. There's a lot of surgeons, if somebody walks in, their BMI is too high, they have diabetes, they smoke, any other comorbidities that they have, and they're going to select to not operate on these patients. And some of these patients can only find a few surgeons that will deal with cases like theirs already. So what do you do in a situation where you have enough data to pretty, accurately determine what kind of outcomes individuals are going to get, and the surgeon's not going to make as much money because it's a more expensive patient. Those are real challenges, and this isn't just something that, this is something that the entire industry is going to have to deal with. These questions come up all the time, and don't have the answers for them yet, but it's fun working in an environment where you actually get to think about what the future of this might look like.
And then, so the other aspect of that is really trying to gather these stories, especially from the users that you're trying to serve, and then being able to use that information as part of the design process and then as part of the substantiation. Is there any issues around the gathering of stories and telling the stories of the actual users that you're trying to serve?
We do something called journey mapping very frequently, and we'll follow actual patients or kind of a composite patient along their process and look through.
Can you just explain what composite patient means?
Well, no one person goes through everything. So you can look across a spectrum of people and kind of squish them all together into one individual that represents a larger group of people. And so we'll do that, and we'll create like their entire experience, and we'll think about how they felt, their fears, their anxieties, what kinds of things they did, who they interacted with, did they bring in their family for this sort of thing? And that building that experience helps you understand where along the process you can interject change for good. So, our focus, or the focus I usually have, is primarily on the surgical arena. So when the person is in the operating room. But there's a whole scope that happens outside of that. And we actually, focus on that as well. What do you do when you find out that you might need spine surgery? The first thing you're going to do is probably look online and look for some information. It's a very scary experience. So how can you present information in a way that isn't as scary or is informative in the best possible way, and expanding beyond that?
Great. Any other?
I guess, just one thing in my work I've tried to experiment with a lot is bringing users into the design team as well. So taking like a participatory design, or sometimes called co-design model. So like for the hackathon, for example, we tried to bring together people who have these lived experiences that we don't have. And there's a reason we're not designing the next breast pump, and instead we're trying to more create containers for other people to design things that meet their own needs. And found that was very successful. Like as one example, there was a project that came out of the second hackathon that was, it was a infant feeding toolkit for natural disasters that was developed by a team from New Orleans that has experience with that. So that's not something that was even on our radar. And so it was just really incredible that they kind of came in and just solved this problem with the, collaboration of everyone else in the room. But that's a really cool approach that sometimes works for technology design.
Cool. Okay. So I have one more prompt. And I think for me, this is probably, like where it becomes the practical aspect of what we've been talking about. But what advice, recommendations would you give to designers to be successful designing in this space? And so even to elaborate on that, was there a pivotal experience, situation, or an aha moment in your career that affects your design process or your product development strategies? So I'll start with you, Roman.
Honestly, I can't think of a pivotal moment in my career, but the moment that I understood that industrial design existed, and I had been looking for that for a while, that was pivotal for me. So I was actually a mechanical engineering student originally, and I went to just a lecture. It was a 1-credit class. That was all we were required to do for art appreciation in the mechanical engineering program. But I've always been into art, and I was at this lecture, and an industrial designer spoke, and I was like, that's it, that's what I've been looking for. So for me, that was pivotal, and I was chasing it ever since then.
So when did you go into sculpture?
So after I decided that I wasn't interested in mechanical engineering anymore, at the beginning of my senior year of my first degree, I switched my major to sculpture. So my father was really excited. But, I did that, and I don't regret it. So the other part of your question?
I don't, that pivotal moment in, how does it affect your design process or product development strategy?
So we use a lot of different processes, and me personally, I focus on the user primarily. So I'm one industrial designer, and for a number of years, I was the only industrial designer that was active at Spine. There's almost 300 engineers there, and the company has, I don't know, probably, if you count the entire company, we're close to 1,000 employees, and me, and it's over $1 billion company. So there's a significant amount of work that's happening, and being able to be the advocate for the people that are actually using these products and actually affected by them, and focusing on the usability aspect, that is the strongest way to get a seat at the table and to really make an impact that I found in my field. So.
Were you intimidated by all these engineers around you, even though you were in engineering?
No.
Great.
So far, everybody I've worked with there has been very enjoyable to work with. So that's a really nice thing. I haven't always experienced that in my entire career. So, but it's good.
Again, what is it that you said that helped you make your way to the table and make an impact?
Usability. So human factors engineering, focusing on making that argument for, you can't just say you want to do something because you feel that's the right thing to do. You have to back it up with evidence. And it's really hard to back up stylistic elements with evidence. But if you're focusing on anthropometrics and any human factors-based data, you can actually look and say, well, it shouldn't be that color because people with poor vision can't see that color and see the contrast. You should change it to this material because people have a better grip with it. You can make arguments that are realistic and you can back up with data. And once you get known for that in an organization, people will come to you and they'll be, this guy knows, he's an authority, and you can make more of an impact.
And then you can slip in the stylize.
Yes. Slip it in the back.
Yes.
So I think you asked for some advice first. So my advice, I have two pieces of advice for you. One is to stay curious. One of the biggest pitfalls that I think you can get into when you're designing is getting to a point where you feel like, you've been doing this for a while and you kind of know enough. You don't really need to check in with the users. You don't really need to be relying on, research and things like that. You kind of got it. And I think, there's a lot that can be done through that approach, but I think it's a pitfall you should watch out for. But Roman stole a little bit of my thunder, but my biggest piece of advice is to understand how unique it is to be in a position to be an advocate for your users. My aha moment was, after consulting for a few projects, realizing that I was one of very few people in the room who had actually sat down with the users one-on-one and could communicate clearly what they needed to engineers who maybe have never met their actual users. They've spent their entire lives in cubicle land and just don't understand what it's like to be on the receiving end of their user interface. So I would say, it really hit home for me when I was in, a relatively boring usability study of an injection device for patients with multiple sclerosis. We were just going through the motions. It was an evaluation, kind of a summative evaluation, which happens right at the very end of product development. Things are ready to go. You're just gathering the data that you need to send to FDA to prove that your device is safe. And we're sitting across the table from people who are, towards the end of the session, finding themselves in tears because they're realizing that for so long, an interaction that has caused them pain and discomfort and has been a point of confusion and just problematic for them in their lives is going to be that much easier because this device pushes the design forward and understands its users that much better, that they're taking away some of those complications. And that is really when it hit home for me, how much of an impact we can have in just being that voice for our users.
That's awesome.
My lessons learned are two, I guess. The first one is just kind of remembering that everything's a process. So like I told you the story about those 2 hackathons, and after the first one, like we really thought we'd done something amazing, and then we kind of were like, oh, maybe it wasn't exactly what we thought. But it was still a step forward, and it kind of led us to the next step. So just kind of like making peace with the fact that everything's a process and it can always be better, and so forth. And then the second piece of advice is just something I've definitely learned from MassArt is just to find your communities and find new ones all the time. So like I came to MassArt after spending several years at MIT, and I kind of realized there was something missing in kind of sort of my social network and the people that I was learning from, and what was missing was definitely MassArt. So I think it's really good to try and find new communities to help push your brain in different directions. So.
Thanks for being
Thanks,
a great,
guys.
yeah, and thanks for being a great advocate of. Nazareth.
Okay, so I don't really have any major aha moments myself, but having grown up watching my dad do construction for over 20 some odd years, there was always kind of like an influence to want to build things, and at the same time seeing his sort of interest in art and sculpture in particular, that definitely grew on me. And so I kind of knew from an early age, I guess I was lucky enough, I do feel lucky enough to be able to say that I kind of had a sense of what I was interested in, and that I wanted to be able to, create things. So that kind of got me into architecture. This isn't really an aha moment, but I remember, and it's crazy that I still remember this, but I remember for the very first time I saw somebody, do we have any 3D people in here, like industrial design people here?
Yeah.
Yeah, the first time I saw somebody loft 2 curves and make a surface in Rhino, like 16 years ago, I was completely blown away. I just thought, like, that's it. Anything is possible now. Like, this is it. Yeah, it sounds kind of crazy to say that now, but that experience like still remains with me that many years later, and I think to me that just means don't ever underestimate like any insignificant small experience, occurrence, mistake, thing that you happen to either stumble upon or think that you may think is not worthwhile, because more often than not there's probably something there, and I think it's really that that curiosity component of it that is going to kind of drive you forward and allow you to kind of come out on the other end with helping you realize what it is that you're really passionate about. And I think the other thing that I would add to that is don't be afraid to kind of step out of your domain and take a bit of a leap of faith and try something new. I'm not an industrial designer, not even remotely by background or any of that, but I think having had the opportunity to join a team since day one and really apply everything that I've kind of learned and acquired along the way, I think that really reminded me of what it is that I'm truly excited about. And I would encourage you guys to kind of step out there and try something new, and don't be afraid, just go for it.
Awesome. Okay, so I think we have a couple of minutes for some questions. Does anyone have any questions from the audience? Yeah.
So you were talking about how that you don't collect any data from your users. With all the kind of the stuff about like tech companies like not really being honest with us, do you find that people like not to say that your company's doing something wrong, but do you find that people believe you, or that they're still like, are you guys really telling us the truth? Or
We haven't even launched a product yet. I mean, it's no, I really do mean that. There's obviously some key things that you're going to have to pick up, but like we're not tracking, we're not documenting, we're not analyzing, any of the kind of visual stuff at all. I mean that. Yeah.
Any? Yeah. You can scream if you want. Yeah.
We can hear you.
I'm curious about what your design process is like when you're testing things out. How much sketching is going on, how much prototyping is going on, how much just talk a bit about that.
Yeah, everything from start to finish. So we will see a problem, or the company may have identified an issue. We'll do market research. We'll understand the competition. We'll look at other products that are similar, do concept sketches. We'll make rapid prototypes. We've got a very large 3D printing facility on campus. We can manufacture basically any metal tool we want on campus. And we have a full institute. So we teach surgeons how to do procedures. So we have 3 cadaver labs as well. So we'll take these prototypes into the lab, we'll try them out, we'll do the procedures, make variations, adjustments, all the way up to finished product.
Maybe Alexis, you have a process you can.
I guess lately a lot of my work has been like designing containers for other people to design things. So that involves, not a lot of sketching, but a lot of, I guess, relationship building, I'd say. So a lot of listening and learning from people. Yeah, so it's kind of different level of design. But I do, here in the furniture design program, do a lot of sketching and stuff too. So it just kind of depends on the thing. It's a good question. I guess for us, it's a really interdisciplinary place. So there's design folks and engineers. Everyone's kind of coming from a different domain. So I think it has a nice quality of everyone is primed to learn from each other. So I find it a really friendly place in that respect. We were actually we were in a class together at MIT a couple years ago. Yeah, so it has that spirit. One challenge is, I mentioned my group is kind of the civic media lab. We tend to be a little bit more techno-critical than some of the rest. So I teach a class there called Technology for Social Change, and it's got quite a critical eye in the class. And so sometimes it can be a challenge to give kind critique to your colleagues who might have some great idea for some futuristic technology that you might see some potential ethical pitfalls. So figuring out how to communicate those things can be a bit tricky, but.
I was just curious, where do you all find yourselves working in the most during the process? Do you find yourselves working more towards initial concept ideation, or towards all the way towards the end, or I don't know.
Can I venture a response and then sure. Okay. Ideally, we would be involved in the whole process from start to finish. We would be involved as much in the front end as we are kind of close to production equivalency and ready to launch. Sometimes that's not the case, and as Roman kind of described, we are a very large company, and there are few designers and even fewer human factors engineers. And so the challenge is, how do you allocate those resources strategically so they have the most impact across all the projects the company is really working on? And so it's common that other project team members, this gets back to working on an interdisciplinary team, other project team members like quality engineers, marketing folks, regulatory folks, project engineers, and the like are responsible for doing some of the design work and some of the usability evaluations that we would otherwise be doing if we were multiplied by 100. So that's kind of a short-ish answer.
So our development cycle is very long. I've been on one project in particular for almost 7 years. It's coming out soon.
That's longer than the aircraft industry. That's long.
So the average is about 3 years. They can vary quite widely. And where do we spend the most time in that process? It depends on the project entirely. So I would love to spend all the, the bulk of the time in the concept development, because that's my favorite. But a lot of it is not that. That's maybe a quarter to a third, and then half of it is in iterative design cycles to get to a design that is really robust, and then it goes through manufacturing processes and testing, validation for the rest of the process. So, but it can vary from, on a project for like a month of concept development to, a couple of years.
We'll take the last two questions and then we're going to have to wrap up. Thanks.
This is one to talk to human factor specialist. Right? I have one question more specifically. You are very involved with observing the user prior to the design concepts being developed, and how much do you guys like follow up with the users after the product has been finalized? Like, is there like some sort of a follow up, and if so, it's like just a presentation or like a period of time that you guys follow up to see if the product is actually responding to the point of the design?
Sure. Yeah. So for medical devices, that's again pretty regulated. There's an expectation for medical device manufacturers to do what's called post-market surveillance. And so basically, once a product is released to market, any adverse events that happen, any things that don't go quite as planned, that get reported, eventually filter back to the manufacturer, and then it's up to the manufacturer to incorporate that into a design loop if necessary for that released product. As for following up with specific users, so people who we bring in for usability evaluations, we do have the opportunity to do that. So Johnson & Johnson works a lot with what we call design surgeons. And so those are kind of key opinion leaders that we bring in, and they advise us. They're very experienced in their field, and they're really kind of working side by side with the engineers and the designers on developing the product. And of course, they are heavily involved throughout the product development and launch, and then we follow up with them, of course, afterwards. That said, we can't develop a product that's only intended for those super experienced, really knowledgeable users. And so, we do have to talk to kind of the average user throughout, and I'm not sure that the touch points are as kind of set for those types of users, but there are many ways of kind of touching back with the end user.
Okay. Abigail, you have one more?
So this question is inspired by the fact that I'm soon to be graduating. It seems like a lot of you have had really interesting career paths that haven't always aligned with what you went to school with. So as someone who's graduating with an industrial design degree, kind of there's that option to go to a lot of different career paths where the job description isn't always all the things that you have learned. So do any of you have any advice for kind of like stretching yourself in terms of when you're looking for jobs, or how you shape your career?
That's a good question. Generally, I think that people think of going agency or corporate as kind of like a big delineator. I started out in agency, and it's a very different environment. I like the kind of consistency and comfort of corporate, but it's a lot slower. So it kind of depends on what you're looking for. If you're comfortable with a little bit more anxiety, I would consider agency. If you're comfortable with frustration, I would consider corporate. So, think about what you want to do and where you want to be in 5 to 10 years, because after about 5 years, it can be difficult to switch between fields. So if you start out in like small appliances, it can be difficult to switch to medical devices, depending on the category. So when in my career, I started out doing a lot of tools and automotive work. So it was very mechanical, but it's very similar. And when they actually hired me at Rubbermaid, I told them, they asked me, why do you want this job? And I said, well, I really want to design medical devices, but these are very similar because these are, very specific devices for very specific user group. They're all handheld, and that was the thing that kind of drove me of what I wanted to do. So if you kind of know the underpinning of what excites you, you can kind of tailor what kind of jobs you look for.
That was really a good answer. And that was a really tough question. I agree. So we have to wrap up, yeah? So, can I just ask for like one more thing, like if as a parting information from each one of you in terms of like the future of where you think things are going. If you have like, one or two sentences that you want to wrap up with, that'd be great. Anyone, I'll jump in with you because you seem more.
Sure, I'm eager, I'm ready to go. Yeah. The field of human factors is wide open, and especially in medical devices. In Boston, this is the place to be for human factors, and there are just not enough of us out there. And so I would say that, given your unique role, you have a design mindset. If you have a passion for the user and for understanding why people interact with things and how they interact with things the way they do, consider a career in human factors. You still get to work with lovely designers, and you can still kind of influence the design, but
You can do both.
You can do both. That's right.
Anyone else? Parting words? No?
I can't wait for self-driving cars. And
I was really trying to stay away from that.
I'm super excited about them. And robotic surgery, it's coming.
Oh, yeah. That's the other thing that we were talking about. Who wants to be able to talk to a surgeon that doesn't talk to them? Like, how do I know my surgeon if it's a robot? Like, where is my comfort level of this machine that I'm relying on doing this most critical thing that saves my life?
Ooh.
Yes, it's coming. It's coming.
If I could just chime in real quick, we have kind of an ongoing joke at PFF where we talk about, the future of transportation is walking. And,
excellent.
I mean, it's a joke, but at the same time, there is really something there about like trying to distill something down to the most like basic human factor possible, and walking is it for us. So.
That's great. I think that's where we leave it. That's perfect. Thank you guys so much for coming. Thank you guys. It's been a pleasure to talk with you. So thank you. All right.
Thank you.